What percentage of Americans actually have health insurance?
About 85% of the country is covered by health insurance. It's changed over the past several years. It's dropping, but it's still technically a majority of the country. Well, there are basically three different types of health insurance. It's like a cafeteria. You can consider it that. The POS is the middle ground. HMO is the health maintenance organization, which means you have to go through gatekeepers before you can see specialists. There's a lot more hoops that you have to jump through to get health care, but the cost is lower. Premiums are lower and the out-of-pockets are lower. The other edge of it, or end of it, is the PPOs, which is the preferred service, where you can do what you want, go to a specialist if you so choose, and there's less having to go through your primary care doctor to get care. I mean, you really have to decide, really look at your health situation very critically. How many times a year do you really think that you're needing to see the doctor? Somebody's young and healthy, maybe go once or twice a year. Something with a high deductible, low premiums would be ideal for that person. But if you have a medical problem that's chronic and you know that you have to take medications and see the doctor frequently, then you want to try to limit your out-of-pocket costs, and HMOs and POSs would be a better choice. It's interesting, there's a difference between health insurance and health care, and that's a very subtle difference, but it's people need to keep that in mind. Just because you have health insurance doesn't mean you're going to be able to afford to go to the doctor, because the premiums and the deductibles and the co-insurances, basically your out-of-pocket is so high. So my recommendation to my patients is to consider getting supplemental insurance, like AARP if you're a senior, or things like AFLAC. Don't use your health insurance if you don't have to. If you go and you talk to your healthcare provider, go to surgery centers, and you say that, look, I want to know what is the deal you can make with me if I pay out of pocket. You're going to get a great deal, sometimes up to 70% off of what you think you're going to pay.
If you can, list the possible illnesses that these children coming from these countries might have. I mean, I certainly could guess, but I know TB, and include in there the antibiotic-resistant form of that as well.
So there's measles, there's mumps, there's chickenpox, which most of us have been vaccinated for, but infants haven't yet, and the senior citizens are all at risk, or people with HIV or other immune compromising diseases are at risk. Then you have scabies, you have tuberculosis, you have dengue fever, all sorts of tropical diseases that I, as a healthcare professional, don't have a lot of facility with because I don't know tropical medicine. So I can foresee a lot of pediatricians, ENTs, people on the front line are going to have to really brush up on tropical diseases so that we know what we're looking at. My problem with this is that the government has no regard for us as American citizens. Look, my dad was an immigrant. I am not against legal immigration at all. But the way this is being done, it is being done haphazard, and it's all about winning at any cost. And it's political strategy without regard for health. And once these things get a foothold in our country, we're a problem.
Do you believe the architects of Obamacare should be listening to these patients, should be listening more to the doctors, to be more in tune to maybe what pain they're going through?
Absolutely. I mean, I understand the thought behind it. You wanted to offer access to health care for as many Americans as you could possibly offer it. But the way that it went about, they never asked the doctors, they never asked the patients, they never asked the people on the front line what needed to be done to include people. And what they did is they doubled down on the most expensive aspects of healthcare, and they promised people they were going to get something for nothing, and it's not happening. As a matter of fact, it's going to become more expensive as it goes along. It's about centralizing healthcare. We are the last country of the developed world who are entering the socialized medicine system. That's what this Affordable Care Act is pushing us towards. And what that means is the government takes control. It's no longer the doctor and the patient who get to decide what constitutes healthcare. As a matter of fact, again, a personal anecdote, I'm getting letters, and doctors across the country are getting letters that what we recommend for our patients is not medically necessary, which means the government and the insurance companies are now practicing medicine. And this is really now becoming a two-tier system. Those who can afford to opt out do so, and those who can't are stuck in a system that denies them access and denies them care. That's the bottom line. That's the stark reality for every doctor on the front line. It's about being able to offer services, being able to keep your doors open, pay your staff, and be able to practice medicine where the patient interest is first, not cost control. That's the choice, and I'm making my choice. I will not be a part of Obamacare. I can't be, because the Hippocratic Oath to me is sacrosanct. And so what I'm doing, and many independent doctors are doing, are now figuring out ways to work around the system. I offer barter for my practice. I offer sliding scale. I work with people who don't have insurance, and there's resources out there people don't know about. It's actually cheaper now to access healthcare if you don't use your insurance.
By making much better use of this new information, we will save money and save lives, and your care will be much better. It's incredible. We're also joined today by Dr. Elaina George, a longtime advocate for patients. Elaina, please come up and tell them a little bit about what transparency means. Thank you.
I love being a doctor. However, one of the most challenging things has been the inability to be an effective advocate for my patients. I've had patients deny themselves care because they don't know how much a service will cost, or worse, be stuck with a costly bill that they didn't expect. I have felt powerless at times because of my inability to help them, especially if I have to send them to a hospital and we can't find out the price of the service. Price transparency is the solution to this problem. When patients become healthcare consumers, it will drive prices down, quality up, and most importantly, help doctors serve their patients better. Thank you, President Trump, for this executive order.
Thank you, Elaina.
This executive order, what did the president do to Obamacare?
Well, he released the yoke of the mandates that people have been suffering under. The problem with the Affordable Care Act is all of these rules and regulations and forcing people to buy something that they didn't need and couldn't afford. What he's done now is allow people to have a choice. If you like Obamacare, it should get better. If you don't like it, you get to leave it and find something that works better for you. Those that have Medicaid, that's really what Obamacare was, an expansion of Medicaid. Let's talk about it on the front line. When Congress talks about expansion of Medicaid, it sounds wonderful, as if you're going to get everything you want. But in actuality, most doctors don't take it. Most hospitals have stopped taking Medicaid. The big cancer care, they weren't even taking the Affordable Care Act plans. So in actuality, those people may get better care if they're able to opt away from the Affordable Care Act plans. Medicare doesn't change. And as a matter of fact, I think what they should have done from the get-go is just expand Medicare for those people who are sick and have pre-existing conditions, and they should have left the rest of the healthcare system alone. If we just open up the free market more for them, that would also help them as well. I'd like to see direct primary care get more coverage under the insurance companies, so that becomes an alternative that insurance pays for. That's the cheapest aspects of our healthcare system. Doctors who list their prices online, have price transparency, can see patients the same day. That's really what's going to hold down costs, competition. And the hospitals have none right now, so they can charge whatever they like, and they won't become transparent unless they're forced to do that. And the patients need to be consumers. So the more the patient knows, the better healthcare choices they can make. And I think it's the patient and the doctor that are going to make healthcare changes, not Congress.